mass burials, funerals postponed indefinitely, mobile morgues shipped out, and Zoom funerals. These are some of the many ways countries around the world are handling the more than 200,000 people dead as a result of the novel coronavirus.
This is just unprecedented in the history of this city or country. We are experiencing the loss of a 9/11 a couple times a week. That's going on week after week.
For now, it's meant huge changes to the rituals of how people say goodbye and ultimately grieve.
When a funeral takes place, tons of people come out because it's a loved one, a community member. Now with Corona and the pandemic, loved ones can't be with their family members in the hospital as they're taking their last breaths.
Will this pandemic change the way society mourns? Italy was the first European country to lock down, but those measures didn't stop its death toll from quickly exceeding China's. Italians were told funerals were cancelled indefinitely. It hit hard in a country still heavily influenced by strong Roman Catholic values and traditions. People were reportedly dying alone with their bodies sealed in their homes because Italy was running out of coffins to store them. Army convoys had to dispose of bodies, undertakers were infected on the job despite wearing protective gear. Within a matter of days, Italy would also have to make huge changes to its daily life, and countries around the world would soon follow. The US now has more than 1 million confirmed cases of COVID-19, with the highest numbers of hospitalizations and deaths in New York City.
To call New York the epicenter of Corona in the United States wouldn't even do justice to what's really happening here.
The number of people dying in New York City is probably 5 or more times regular levels. We are so far beyond the normal pace of deaths in New York City, and we need to take extraordinary measures.
It's like Italy was. Doctors lacking PPE, funeral homes overwhelmed, regional lockdowns, and in some places, military intervention. But unlike Italy, New York was already struggling with finding places to bury the dead before the pandemic even started.
I represent a district in northern Manhattan that has been extremely hard hit by this virus disproportionately, as have all communities of color throughout New York City and all low-income communities really nationally. The result is that we've had a lot of fatalities. My office is called on regularly by families who are not able to get a funeral home or not able to get cremation services. This is really tough.
Religious communities across the US have been hit hard by the novel coronavirus. This is a look inside the Islamic International Funeral Home in Brooklyn, New York. It shows the strain death care workers are facing.
The ritual washing that we would do is not something that is possible, both for just kind of the safety of the funeral home staff, as well as this literal seal that is on most of these bodies.
Once New York's hospitals became overwhelmed, the Federal Emergency Management Agency stepped in to supply refrigerator trucks to serve as temporary morgues. Then came the 100,000 body bags from the Department of Defense to account for what was described as a best-case scenario death toll. But even with the government's assistance, the city's hospitals have limited room to store bodies.
This is a major challenge for both the Muslim and Jewish communities of New York City, where a quick burial is the tradition, and where there are strict levels of observance related to burial.
This means funeral homes, morgues, and crematories are hitting capacity, even those operating 24 hours a day with military assistance.
The prayer is, instead of, presided over by hundreds, if not thousands, will be at most like a handful of people, and they will then take the body to the burial site, and the burial grounds are also restricting the number of funerals that can happen in a day, which adds further delay to it. So all in all, it creates a lot of challenge, a lot of stress, a lot of emotional kind of angst for people whose loved ones have passed away.
Add into the mix a lack of PPE for morticians and their staff. The combination has crippled New York's death care system and forced city officials to look towards its backup plan. This plan was originally established back in 2008. The pandemic influenza surge plan was made by New York's chief medical examiner. The document states that if and when the city runs out of space for bodies, temporary internment would occur at Hart Island.
Well, Hart Island has been part of the history of New York for 150 years, since the Civil War, and it's been a part of almost every major episode, from smallpox to tuberculosis to the Spanish flu. Hart has always been a place where people who had no other option have been buried, and so it's people who perhaps died without the money for a private burial or died isolated, perhaps because they were homeless, had no next of kin. This is a little bit different now. There just isn't enough capacity in funeral homes and private cemeteries.
But this 1 mile stretch of land that's home to more than 1 million bodies was already on its way to reaching capacity. Mass graves stacked on top of each other, more than 100 bodies buried per burial plot. And the island itself is owned by the Department of Corrections, which means that for over 150 years, prisoners from nearby Rikers Island have buried New York's unclaimed bodies.
It's like a twist out of a Dickens novel, that we'd have inmates doing this work.
However, one thing has changed.
Prisoners, for the first time ever, started to refuse to do this work because of their understandable fear of catching the virus from the bodies. Now the burials there are being done no longer by inmates, but by a private contractor.
And if you're wondering why the city can't just go ahead and cremate bodies to make more space, there are several reasons. 1. Cremation laws. Each state has specific regulations when it comes to cremation. New York's laws specifically state that an individual cannot be cremated without written consent from that individual or immediate family. Within certain religions, for example Islam and Judaism, cremation is strictly forbidden.
A lot of Muslim leaders have had conversations with the mayor's office to discuss what that means. And they've given complete assurance that there will be no cremation, which is problematic in our religious tradition, nor will there be any mass burial grounds.
Even if the body isn't cremated, a quick mass burial goes against many religious beliefs. But according to the officials,
there really isn't another option, even for those who die with family who are actively engaged, and even family who have financial resources. It's not really about that right now. There just isn't enough capacity in funeral homes and private cemeteries.
But this too is only temporary, because in this very same planning document, officials also note that the island, quote, may not be able to accommodate a large influx of decedents requiring burial, something this pandemic has unfortunately spurred. So, the city might need to consider drafting a backup plan for its backup plan. Imam Latif says his community already has.
Our funeral prayer also has a version of it that can be prayed without the body being present. And where people are able to perform that on their own in their home to kind of help them in their own healing process, so to speak, and let them be there.
Leaving some to resort to their only option, live streaming burials.
They will live stream so that people can at least, witness the prayer being done, see the burial taking place, and be a part of it as best as they can in the given circumstances.
No one knows what the long-term impact of these changes might be after the pandemic passes.
Just like 9/11 changed everything about how we handled security in New York City and in the world, in some positive ways and in some that were excessive and, in my opinion, unwarranted, this crisis is also going to change, I think, everything about how we deal with healthcare, how we prepare for pandemics, and ultimately also how we prepare to handle our dead in such cases.
Will it unite humanity or deepen the divide?
We had members of our community who said that they were getting word from various funeral agencies that it would be $10,000 to bury someone, and to jump from $1,500, $2,000 to 5 times that amount when many people are struggling, it creates unnecessary burden.
But coronavirus has definitely sparked a larger conversation about how society conceptualizes death.
This pandemic has revealed so much, right? You have immense beauty and goodness from these doctors and first responders who, are made of whatever they're made of, that they're getting up every day. And despite the amount of illness and death that they're absorbing and their sheer exhaustion, they're still going to help people and still support people in their time of need. But then you have a lot of revelations of real greed and real selfishness and ugliness, and people, are hoarding and they're raising prices to take advantage of things in their own self-interest and egocentricity.
This is an incredibly tough situation, and happening with just a brutal and relentless death rate. And though we do appear to finally be moving in the right direction, we need to understand that we're still in a really difficult place today.